So hello guys, welcome back again. We are on box 5.3 population health need assessment tool. So this is part 2 because it is very big. So I have to divide into parts because one part will be on the previous video and I am going to upload next part because then otherwise the video will be very long and you will get bored. So this is further questions based on living situation. Do you have a home? Do you live alone? Whom do you live with at home? Do you drink alcohol? Any other type of drug use? Have you been exposed to environmental irritants? Have you had problems with asthma, anemia, lead exposure, ear infections, gastrointestinal illness, or mental health? So, are you willing to follow up on your healthcare recommendations given the necessary resources? Further questions based on health insurance coverage. As you know, guys, they do health insurance, so we have to ask questions related. We should know about health insurance coverage questions as well. What health insurance do you have? Do you have the financial means to pay for your health care? Are you willing to work with a social worker to seek health coverage? Then further question being based okay that based on financial status and access to resources. What is your education level? What is your income? Do you have family you are in contact with? Is anyone in your immediate family disabled? Do you have a support system? Do you live in a safe community? Do you seek healthcare on a routine basis? Are you willing to work with a social worker to increase your access to community resources? Then further questions related to abuse. Do you have or have you had any bruises, sprains, broken bones, fatigue, shortness of breath, muscle tension, involuntary shaking, changes in eating or sleeping, sexual dysfunction, or fertility problems? Do you experience nightmares, anxiety, uncontrollable thoughts, depression, or low self esteem? Do you experience night that I have read? Do you have anxiety or depression? Do you have thoughts of harming yourself or others? If so, do you have a plan? Do you ever feel hopeless, worthless, apprehensive, discouraged? Do you lack motivation or faith? Have you questioned your trust in others? For a child, do you have any problems at school? Are you bullied? So when we are, because our client should be elderly at any age. We have to deal, all ages as an Nclex RN. So when you are dealing with child, you have to ask this question if they have any problem at school. Then further questions based on gender and sexual orientation. So this is as gender and sexual orientation. Can you describe your gender, identify, and sexual orientation preferences? Which pronoun would you like us to use for you? He, she, they, other. Do you seek regular and routine health care? When were you last seen? When was your last breast exam, mammogram, pap smear, testicular exam, prostate exam? Do you do a breast self examination or a testicular self examination? Do you have any past medical history? Let's go. Are you sexually active? If so, how many partners do you have? Do you employ safe sex practices? Do you smoke, drink alcohol, or use any other type of drug? 5.3 box 5.3 is quite big. So, do you have any problems with depression or anxiety? Do you have thoughts of harming yourself or others? If so, do you have a plan? Do you take hormone therapy? Are you up to date on your immunizations? Do you have children? If not, do you wish to or do you plan on having children? Do you feel you have access to necessary resources such as healthcare or other benefits? Further questions related to mental health. If there is a mental health problem, we have to ask these questions. Do you seek routine health care? Describe your eating habits in a 24-hour period. Describe your activity level. Do you have any past medical history? Do you take any medications? If so, what are they? And do you experience any side effects? Do you smoke, drink, or use any other type of drug? Do you experience depression or anxiety? Do you have thoughts of harming yourself or others? If so, do you have a plan? What do you do to cope with stressful situations? Do these coping strategies help you? Do you have a support person in your life? Are you sexually active? If so, do you employ safe sex practices? How many partners do you have? So, further questions, if related to veteran military status, do you have any problems with mental health such as post traumatic stress disorder, moral injury? Have you had any traumatic brain injuries? Have you have had any other injuries? So, describe your living situation. Are you interested in any community support groups? So, this is further questions related to incarceration. Have you ever been a victim of abuse or rape? Do you have any past medical history, particularly asthma, diabetes mellitus, hypertension, heart disease, mental health problems, or communicable disease? Further questions related to immigration. Do you have problems with mental health? Do you able to speak and understand English? Do you have access to resources such as housing, transportation, healthcare, educational service? Do you have any past medical history such as accidents, injuries, hypothermia, gastrointestinal illness, heart problems, pregnancy complications, diabetes, hypertension, malnutrition, or infectious or communicable disease? I'm reading here quite fast little bit because all these questions are almost the same, and I think you have got the idea, the basic concept, what kind of questions are they. Further questions related to chronic illness. Do you have access to a primary healthcare provider? Do you see a primary healthcare provider or specialist on a regular basis? Are you able to follow up on the recommendations made by your primary healthcare provider or a specialist? Then, summary, is there anything else you would like to share regarding your ability to maintain your health or any other issue or concern? So, guys, this was the box 5.3. It was quite long and big, but this is basic kind of needs assessment tool that you have to focus on. You have to memorize this. Just I would give you one more tip, guys. If you don't have time to read, just watch and listen. If you don't have time to watch, just listen, and it will fit in your brain. Then when you will have exam situation, you will remember all these things. So we have read 5.3. Our next video will be further going on. Then I have to read all this F, G, and J, K. I think I will read this now. Then we will start from COVID-19 coronavirus, the next video. So we will finish this video like this. So this bullet point we have to read: encounters with clients need to elicit the client's unique perspectives based on their own preferences. This will allow the nurse to understand what healthcare treatment will be realistic and acceptable. Okay, guys. So, number F, it is imperative for nurses to understand that population groups may share dominant characteristics. However, all clients are individuals and stereotyping needs to be avoided. G, it is important for nurses to be aware of the health problems that are common in a population group so that specific attention can be used when performing a comprehensive assessment. So I have already, I think, share a picture regarding health problems that are common in a population group. Okay. So, and preventing that client from contracting that illness. Number J, the nurse needs to be aware of the critical measure needed to protect oneself from contracting the virus and must be an advocate in educating the public about the measures to prevent spread. These primary measures are hand washing, wearing a mask and eye protection, physical distancing, avoiding crowded situations, avoiding close contact with people who are sick, covering the nose and mouth when coughing or sneezing, keeping the hands away from the eyes and face, and self quarantine. This is very, everyone knows about this. Keep distancing and sneezing and this all things. I will self quarantine we have done in 2021 and we have dealt with 2022 as well. Refer to chapter 23 or 41 that we are going to read again for information about COVID in pregnancy and in children, and chapter 51 for additional information on adults. This is we are going to read later on. But now the next video will be COVID-19 coronavirus sounders book. We are reading word to word. Everyone will stay with me and just watch and listen. If you cannot watch, I'm telling you again, just listen. It will help you to understand. It will help you to sometime to you click the point. So I'm just reading, and maybe sometime I just explain a bit, but it will help you guys. So see you on the next video. Next video will be COVID-19 coronavirus. Bye for now. Stay tuned with me and just subscribe my channel, like and follow and share. Thank you guys. Bye for now.